Hi guys, I'm Susie Hyatt. I'm the lactation consultant here at Natural Beginnings, and I just wanted to talk to you and discuss one of the main concerns that I hear moms talk about when they're worried about breastfeeding. And usually it's a low milk supply. Moms are usually pretty concerned that they may not be making enough milk for their baby. But I find out that they kind of compare themselves to other moms that they know, and if their situation seems a little bit different than whoever they're talking to, they worry that they might not be making enough. Basically, the best way to tell if you've got a good milk supply is if your baby is gaining weight well. Usually if the baby's gaining the appropriate amount of weight, then the milk supply is usually pretty good. You may find that your baby might need to nurse more frequently throughout the day to get the same. But throughout the course of the day, if the baby's eating frequently enough, they should get the amount that they need to gain weight and grow well. Sometimes babies nurse more frequently when they are getting ready to learn a new skill, or if they're not feeling well one day, or sometimes they just need it for extra snuggle time. Breastfeeding to babies is a lot more than just feeding. It's a time for them to be near you and bond with you and to really just spend extra time with you. Some moms feel like they have a low milk supply just because when they're pumping, they may not get out, or they might not be able to collect the amount of milk that they think that they need to. A few things need to be taken into consideration with this. First of all, your baby is much better at removing milk than the pump is. So if you're seeing not that much when you pump, your baby could have gotten a lot more at the breast at that feeding. You also need to take in consideration the time of day that you're pumping. Moms make more milk in the early AM hours than they do in the PM hours. So when the baby's at the breast, they get more food in the early AM hours than they do in the PM hours. So if you're pumping at different times, you'll see different amount of milk. This may explain why sometimes babies are more fussy in the evening and want to nurse more frequently, is because the milk supply might be a little lower just in the evening hours. And you may also compare yourself to moms who have a freezer full of milk. It's not necessary to have all this extra surplus of milk. You really only need to make enough milk for your baby and not a couple of extra babies, unless you have twins or triplets. And your body will adapt for that too, so no worries. Usually if there is a low milk supply, there are several different things that we can do to help increase the milk supply. And usually it's just because things have been mismanaged, or maybe there's been an interruption in how feedings have been going. There are herbs that you can take and some foods that you can eat in a normal diet that have been shown to increase milk supply. There are some pumping strategies that you can do for a few days to pump the volume back up. And the best one is to take what we call a baby honeymoon, and this is where you and the baby get to lay in bed all day, and the baby gets unlimited access to the breast, and even little short latches popping off and on throughout the day will send a signal for your body to make more milk. So those baby honeymoons are really a good way to increase milk supply quickly. But there are moms who truly do have a low milk supply. And this could be based on different reasons. Sometimes the breast anatomy can be a little different, or if mom's had a breast surgery or breast trauma. Usually moms who've had breast reduction surgery, they still can make milk for their baby, but they may find it difficult to make a full supply for their baby. Another reason is sometimes there's a hormonal influence. Maybe if mom has PCOS, or if there's thyroid issues, but those issues we can address as well. The good news is that most of the time you're making just the right amount of milk for your baby. If your supply does seem to drop off, there's lots of ways we can manage to get it back up. And if you truly are struggling with a low supply, you can continue to breastfeed, but sometimes some supplementation may be necessary as well. We can discuss all of those issues if you needed to come in for a breastfeeding consult. If you have any questions or concerns, you can always contact me here at the Birth Center at Natural Beginnings.